My name is Dr. Bradshaw, and this film is intended for my RAD 1611 group and for review for my RAD 2612 group. Right now I'm looking at a close-up on a lateral thoracic view. I'm looking at a digital from the outpatient clinic. Wanted to show you this so that you could see the digital image and what it looks like. We of course can see the vertebral body right here in this area. And so you see the vertebral body right here. You of course can see the IVF. And this structure that is going from the body back to the rest of the segment is called the pedicle. We do see the apophyseal joint that is right here between the superior articular process, which is on this side, to the inferior articular process that is on this side. Now we have ribs coming in, and so that's why this film is so difficult to see as far as all these structures. But you see the ribs coming in, they articulate with the transverse process, then they make the curve and go back in and articulate with the vertebral body. So why it looks so many densities right here is that you have the rib on this side, you have the rib on this side, and of course you're seeing it make the curve and go back around. We out here can see the hilum, also known as the hilus. We can see the area of the heart over in this area. And so this is the structures that you're looking at in the chest cavity. If I move, let's see, I'm going to move this down this way just a little bit. You can see the diaphragm coming down. Let me change that back to a pointer. You see the diaphragm coming down right here. And so this is called your posterior costophrenic sulcus, where the diaphragm meets the rib cage. Posterior costophrenic sulcus is one of the lowest points of the chest cavity. This would be one of the first points to fill up with fluid if there was a problem. We do see from the back of the heart right here to the front of the vertebral body is called the Cardiac Interspace. And so again, that's just the space from the back edge of the heart to the front of the vertebral bodies. If I move this up into this area, I can see the head of the humerus right here, this circular structure, and of course I can see part of the scapula coming down, superimposing these vertebral bodies. Remember, I'm looking at the scapula from a lateral view, and so it is very thin when you look at it from this perspective. You're looking at the scapula from a lateral perspective. We do see our tracheal airspace coming down through here, and so that's why it's so dark right there in that area. This concludes the lateral view.